A legacy of healing. Cuban medical internationalism. Cuba has a long and storied history of providing medical aid and expertise around the world. Since the Cuban Revolution in 1959, this small island nation has consistently demonstrated a commitment to global health equity. This commitment is rooted in the belief that healthcare is a fundamental human right, not a privilege reserved for the wealthy. From disaster relief efforts to long-term medical programs, Cuban doctors, nurses, and technicians have made an indelible mark on global health. The internationalism of Cuban medicine is not merely a matter of policy, it's woven into the very fabric of Cuban society. The island nation has sent hundreds of thousands of medical professionals to every corner of the globe, often to regions with limited access to quality healthcare. This commitment has earned Cuba widespread admiration and gratitude, solidifying its reputation as a global leader in healthcare. The impact of these missions extends far beyond immediate medical care. Cuban medical professionals work to strengthen local healthcare systems, train new generations of doctors and nurses, and empower communities to take charge of their own well-being. This holistic approach to global health assistance sets Cuba apart on the world stage. Global impact. From disaster relief to everyday care. The reach of Cuban medical internationalism is truly global, extending to over 180 countries since 1960. Whether responding to natural disasters like the 2010 Haiti earthquake or combating epidemics like the 2014 Ebola outbreak, Cuban medical teams are often among the first on the ground, providing crucial aid and support. These missions are not limited to emergency situations. Cuba has established long-term medical programs in numerous countries, particularly in Latin America, Africa, and the Caribbean. These programs provide essential healthcare services to underserved populations, addressing a wide range of health challenges from maternal and child health to chronic diseases. One notable example of Cuba's long-term commitment is Operation Miracle, a program that has provided free eye surgery to millions of people across Latin America and the Caribbean. This initiative, launched in 2004, exemplifies Cuba's dedication to addressing health disparities and improving the lives of people in need. The Cuban model emphasizes prevention, community involvement, and training local healthcare workers to ensure the sustainability of these programs. This approach has yielded significant improvements in health indicators in many countries where Cuban medical professionals have served. A right, not a privilege. The Cuban healthcare model. At the heart of Cuba's global health outreach lies a healthcare system that stands in stark contrast to the market-driven models prevalent in many parts of the world. Cuba views healthcare as a fundamental human right, not a commodity. This principle is enshrined in the Cuban Constitution and reflected in the country's commitment to providing universal, accessible, and free healthcare to all its citizens. The Cuban healthcare system is characterized by its emphasis on primary care, prevention, and community health. With a doctor-to-patient ratio that rivals that of many developed nations, Cuba has prioritized ensuring that healthcare is readily available to all segments of its population. This approach has resulted in impressive health outcomes, with Cuba boasting life expectancy and infant mortality rates comparable to those of wealthy nations. The success of the Cuban healthcare model, both domestically and internationally, highlights the transformative potential of a system that prioritizes human well-being over profit. This commitment to healthcare as a human right is at the core of Cuban medical internationalism, driving Cuban doctors, nurses, and technicians to serve those most in need around the world. Challenges and critiques. Navigating a complex world. Despite the undeniable contributions of Cuban medical internationalism, it has not been without its critics. Some argue that Cuban medical professionals are sent abroad primarily to generate revenue for the Cuban government. Others criticize the working conditions of these professionals, citing low pay and separation from family as significant drawbacks. Additionally, Cuban medical missions have faced opposition from the United States government, which views them as a tool of Cuban diplomacy and has imposed sanctions to discourage countries from accepting Cuban medical assistance. Despite these challenges, Cuban medical professionals continue to answer the call to serve, driven by a deep sense of solidarity and a commitment to global health equity. Their unwavering dedication serves as a powerful reminder of the importance of international cooperation and the need to prioritize healthcare as a fundamental human right for all.